not acknowledged as being similar. And because it's not being clinically diagnosed, people are getting a chronic form of it. Now, I think the question is, how do we move it forward? And I think that begins with accepting that you need to be able to provide clinical diagnosis. And I would urge this upon the minister. I was in California recently visiting with family members. A relative on my wife's side of the family is the head of an ER room at a major hospital in San Francisco. And without any preparation of the ground, I asked him about Lyme disease. What do you do? Do you have it here? What do you do with it? He very, very quickly went to symptoms and clinical diagnosis. He said it's preventive. It's 4 weeks of doxycycline and it's gone. He said, we do it preventively here. I said, do you analyze the ticks? He said, we don't bother. We look at the symptoms the patient has. If he has the symptoms, we treat them. Then there's no chance of chronic Lyme disease. And then he said to me, it's just like syphilis. If you don't catch it at the front door, you will never get it out entirely. And the problem that we've got right now is whatever the incidence is out there, we are underdiagnosing it at the front door. We are turning people into chronic Lyme sufferers. And there's a huge consequence of that. I just give you one instance, and then I'll invite response from the minister. This is just one, but it's not untypical. This is a person who between 1999 and 2007, when Dr. Murakami began treating her with a sustained course of antibiotics and who was bedridden the entire time, saw over 22 different physicians, 20 of them medical specialists, 6 specialists in total, a rheumatologist, a gastroenterologist, a geneticist, 2 infectious disease doctors, and a regular doctor. She was diagnosed as having Crohn's disease, then lupus, then MS, then bipolar. She had over 100 collections of blood, 2 barium x-rays, 2 weeks of hospitalization, 3 colonoscopies, 1 laparoscopy, 1 cystoscopy, several sets of x-rays, multiple ultrasounds, bone scans, EKG tests, heart monitoring, 3 MRIs, and 2 CT scans. All of this is avoiding clinical diagnosis of Lyme disease, which is treatable with antibiotics. So I just put that in front of the minister. We have a serious problem. Whatever the incidence is, we're growing this misuse of the healthcare system by not diagnosing. And really, I've come to believe from talking to people, antibiotics are the answer. You know if it's Lyme disease because the symptoms will go away with antibiotics if it's Lyme disease, and if it's not Lyme disease, they won't. So front-end diagnosis is not a huge risk. The question is, when are we going to begin addressing this problem? When are we going to equip doctors to diagnose it at the front end and so reduce the incidence of a treatable disease in British Columbia and stop what's happening to people now, which is terrible suffering? These people can't work for a living. They're debilitated. Some of them lose their mental capacity because it's disorienting.